All right. Good evening, everyone. It is 7:03 p.m. and I would like to call this meeting into session. Um, so welcome. I think we have uh present today. We can start the roll call or just. So we have members of the community and some members of the community board who are present on Zoom and present in person. First thing I'd like to do is do the roll call. So present today, we have Dr. Wayne DeBeetham, chair, present. Um, we have Sebastian Chickapilli, who is en route, and we see you, and we're looking forward to seeing you in person shortly. Dr. Julia Gomez, present. Rabbi Bob Kaplan, also present on Zoom. Steve Matthews.
Present.
Okay, so with that, we have quorum, and so I would like to begin. First off, welcome to the members of the community, and also like to acknowledge one of our special guest speakers, Lee Ashley Fang, who is a community member who will be speaking to us a little bit later. And I think there are also some members of your organization who are present on the Zoom with us as well. So thank you for being in attendance and looking forward to hearing what you have to say. First order of business would be approval of the minutes. And we have copies. Any questions or concerns regarding the minutes as posted?
Move to accept.
Okay. Any second?
Second.
Okay. So the meeting from the minutes of the meeting of November 12th have been put into have been approved. So next up would be the chair's report. And so I'd like to again thank everyone for the very spirited and engaged discussion that we continue to have regarding things that impact our community. Brief summation of some of the things that we had discussed was the impact of the big beautiful bill, the role that a lot of these events would have on insurance premiums. We also discussed the possibility of having State Senator Rivera, and I had been in contact with his office, and he will be in Albany for a lot of the upcoming year. However, there are some days where he will be available. Discuss the possibility that we either have it on our meeting day, or if it's a large enough event, whether we can have this occur maybe on a different day, and maybe integrate with other groups. And so I can pull up his schedule, but we can certainly do some brainstorming about when we would like to have him, and then we can also start when we get that squared away, also start thinking about some of the things that we'd like to discuss with him. Also, in the topic of going with some of that unfinished business, but also topic of big concern is obviously the opening of the vice chair position. And so if there's anyone who is interested in taking that vice chair position, I would strongly encourage you to throw your hat into the ring. We can certainly discuss how that would work. As you know, it is vitally important that we have a vice chair representative, because things happen. And also, I think it's also a wonderful opportunity for anyone, particularly new members, to gain experience as well. We've talked a bit about the budget priorities from before, and this kind of delves into the some of the old business, but I think that is a topic that we would like to discuss at length. when we start thinking about what our priorities and needs and concerns would be in the upcoming budget. And the discussion from last time about the NYC mental health hotline. So did a little research on that. That is 988. You can do call or chat. And in addition, they do have a website and it's I think 988lifeline.org. And so it is a resource that is available to the community in terms of, like I said, call or chat, um, and gives connection to resources and counselors. Uh, we discussed a bit about the state of the domestic violence resources available in the area, particularly with the resources the 50th precinct has to offer. I was able to speak to the members of the domestic violence officer briefly. They do have some of the resources that are available. There's something called Home Plus, which actually helps. It's a resource where they will actually go and change locks for victims of domestic violence. And I don't know the full extent of the services, but that's one of those resources. Um, they are working with Safe Horizon. They do have a victim advocate. However, the victim advocate who is assigned to the 50th precinct is presently in training and orientation, so they don't have the name yet, but they do have resources available. Uh, I have also reached out to Safe Horizon specifically because they have a whole array of resources that they have, and I think it would also be uh, helpful to communicate with them and talk a little bit more at some point in the future. And so hopefully we'll hear from them soon. I think some of the other topics that we discussed were again that collaboration with some of the stakeholders in this jurisdiction, as well as talking about like maybe collaborating with the aging committee, which we are yet to do, but we'd like to discuss doing that at some point in the near future. So we can talk about intimate partner violence, caretaker abuse, social isolation. I think that as has been mentioned by many members of this group and members of the community, I think that that would be a very valuable collaboration that we can certainly entertain doing. And let's see the Mosaic Mental Health, which is will be having a new space on 239. Uh, have also reached out to them, and hopefully we can hear from them and have them come and discuss some of the resources that they have uh, available for the community. Um, that being said, I would certainly like to yield the floor at this time to our guest speaker, Lee Ashley Fang, and I would certainly love for you to talk a little bit more about I think this bill that is potentially coming up, the 1179 2025, and talk a little bit more about topics of harm reduction and fentanyl use. So, Ms. Fang, the floor is yours.
Yes, thank you so much for the introduction. Thank you all for taking the time to meet with us. It's not just me, but I would like to give credit to my other colleagues here. We've just taken interest in this bill, and we'd want to spread awareness and start just starting these conversations on how we can improve this bill. So I just wanted to start off by saying good evening. And the 1179 bill was designed to address New York City ongoing fentanyl overdose crisis. So fentanyl is now involved in the majority of the overdose deaths in our city. Over 2,400 New Yorkers lost their lives this last year um, due to overdose. Much of this stems from people unknowingly using drugs contaminated with fentanyl. One of the most effective and low-cost tools we have to reduce these deaths is fentanyl test strips. But awareness and access across our neighborhoods are still far too limited. I mean, before even coming across this bill, actually, which we all met during a class and we found interest in, I was like, oh wow, I didn't even know there were fentanyl test strips. And then, I came across these lovely ladies and they were telling me their experiences in neighborhoods with people overdosing with fentanyl. And I said, wow, interesting. Okay. So this bill would essentially establish a citywide public outreach and education campaign to change that. It directs the health department to work with harm reduction providers, share multilingual information, and clearly communicate where people can access and safely use test strips. The bill also requires evaluations so we can understand which strategies are working and which communities still need support. And so, with that being said, I will open the floor to my colleagues here. Jessica, Amade, and Makita, they have very direct experiences with people in contact with fentanyl or just in general overdose cases.
Hi, good evening. My name is Amade Javier, and again, thank you so much for giving us the time to speak with you. Just for a little bit more context, we actually did also meet with the Chief of Staff of Councilman Eric Bottcher, who was the one who introduced this bill originally back in February of this year. And although it didn't get a lot of traction because of the election cycle, um, Carl Wilson, the Chief of Staff, actually informed us that it will be reintroduced, and we're actually going to be keeping in touch with him. So we're going to be pretty much hopefully working with him closely on hoping to get this bill passed. With that being said, based on our research, we actually found that 2/3 of people are likely to relapse within weeks to months after addiction treatment. And even those who receive treatment and then relapse are at an even higher risk of overdosing because of their decrease in tolerance to their drug of choice. And the presence of fentanyl further increases the risk of fatalities. And again, just like Lee said, fentanyl test strips would be a useful harm reduction tool, especially for those who are post-treatment. Now, on a personal note, I'm a close family friend and neighbor. I live in Woodlawn, in the Woodlawn Bronx neighborhood. Passed away in August of 2022 at just 27 years old. He battled opiate addiction for over a decade, trying various both inpatient and outpatient treatments, as well as taking classes to become a substance abuse counselor. Unfortunately, he relapsed and passed away due to accidental overdose. I believe that Luke and other people like him who are vulnerable to relapsing should be afforded the chance for harm reduction in the event of a relapse. Personally, I think this bill needs more support, and in my community, it's been happening a lot to people that are younger than 30 years old, but it also does not discriminate in age or socioeconomic demographics. And I just also want to be very clear that INT 1179-2025 is not advocating for drug use, but instead advocating for harm reduction. Thank you. And I think, Jessica, you're up.
Yes, thank you, Amade. Yes, and as my colleagues have said, thank you so much for allowing us to speak tonight. I'm going to talk about more of my personal experience. I work at a syringe exchange site in Mount Vernon, so we get numerous clients coming from the Bronx to avail themselves of syringes. We also dispose of them free of cost, and we don't ask for any kind of identity or immigration proof. We also distribute fentanyl test strips. And as somebody who has been enmeshed in this for the past 3 years, I can tell you that fentanyl test strips are in demand amongst people who use substances, and they're actually putting power back in their hands, which is super important, especially for those in our community who are using substances. It gives them a sense of, I can protect myself. And that is super important. And we get our test strips from the state. We order them online, but because we're an organization, we get them free. But that doesn't mean that they are always accessible or readily available to people who are in the threads of this. And this bill would not only increase access to these test strips, but it would promote education for communities about the dangers of fentanyl and the fact that there are test strips that can help people from accidentally overdosing. And that's why we decided to band together with all of our experience and choose to support this bill even beyond our college class. We are in the preliminary talks of forming a coalition to see this bill into January when it's reintroduced. As Amadei said, it hasn't really moved since February, but because of the elections, it needs to be reintroduced with the new year, and we are interested in following up with it as long as it takes. So yeah, we really appreciate you allowing us to speak, and I'm going to turn it over really quick to finish up to Makita.
Thank you so much, Jessica. Thank you so much, Amadei and Lee. Good evening, everyone. Thank you for having us here tonight. It is such an amazing honor and privilege, and we're very grateful that we're speaking at the perfect place, right? We're discussing about health. Just to add a little insight and depth to what all of my colleagues have said. So I too have had a few family members, but one specific that really stood out to me, was my younger cousin. He was 23 years old. He unfortunately passed away in 2019 from overdose. Not quite sure which drugs precisely because he was using so many illicit substances at the time, cocaine, crack, so it could have been a variation of any of those drugs. But he was found in a crack house. The person that he had gone partying with left him there. We did not know where he was, kept trying to contact him. And finally, the person that he was with informed us that that was the last known place. And then we found out that he unfortunately passed away. This is precisely where legislation like Int 1179/2025 plays a pivotal role because by establishing a public outreach and education campaign, this bill directly addresses the awareness gap, right? It provides the framework and the impetus to inform our community about the dangers of fentanyl and the availability and proper use of test strips. Such a campaign can ensure that these life-saving tools are not only accessible, but also understood and utilized by those who need them the most. Without a legislative mandate and dedicated resources, critical information can remain fragmented and insufficient. And Int 1179/2025 offers a clear path forward, ensuring that our community receives that vital education and has access to harm reduction resources. It is an investment in the safety and well-being of our residents. I urge, right, that we recognize the profound importance of public education and awareness in combating the fentanyl crisis. We implore you to support or try to help us to get this out because, again, we formed this coalition based on a class, but now it has turned into more of a revolution that we're set to try to get as much lives in all the boroughs saved as possible. We know it's impossible to save everyone, but at least if we save one, we've done our job. One of our colleagues who was unable to make it tonight, she's an EMT, and she also wanted for us to speak about having the fentanyl test strips available in hospitals so that hospitals can be able to utilize them as well, so that when cases of overdoses come in, they can also be equipped to be able to then jump into action and hopefully save a life besides using Narcan. So thank you again for having us, and I'll give the floor back to the board.
Thank you. Thank you for that very well researched and passionate presentation. So I think first off, how does your involvement is you said you were involved in a class? I'd like to hear a little bit more. I think a lot of us would like to hear a little bit more about your involvement in this and how you became so passionate about this topic.
I don't mind going again, ladies. So I me I'm personally a KSAC T. I have been for the past 4 years now. So besides having a lived experience with family members, I have also worked directly in this field of substance use. And we all met through our mutual class that we're taking as graduate students at the CUNY Graduate School of Public Health. This specific class is public health advocacy. And it just so coincidentally happened that our assignment was to choose a bill that we were interested in and do research on it, and then come and speak at a public forum such as this community board meetings and testify for a hearing why we feel so passionate about it. However, when the five of us got together, it turns out that each of us are in varying facets of or touching some form of working with illicit substances or clients who are illicit substance users. And we then started speaking even more and realizing that some of us have lived experiences, some of us who have been working in the field have experienced or seen some form of client overdosing. And we then decided that, okay, well, this seems a lot more interesting than just what the class is requiring us to do. And we just kept meeting and forming our, what Mr. Wilson called a coalition, which was a great way of putting it together. And we've decided that we're just going to band together and continue on with our advocacy, because this is such an important and vital, um, not just the bill, but it's just an important and vital aspect of public health that we want to continue on.
No, I'm sorry, I was on Zoom and I just joined in person. Thank you for the presentation. I know that during the start of the presentation, you mentioned about 2,400 deaths in a year in New York City. Do you have a breakdown of that? Like, for example, can we find out how many deaths in our community board?
I don't have that breakdown. However, I can definitely get those stats to the community board at a later time.
And my follow-up question is like, where can we find Narcan and these strips right now? So if someone comes to a call our community board and say, where can we find strips in our community board? Where should we direct them to?
I
I'm
can
gonna
actually
take
take
this.
Oh,
Oh,
you could go ahead. No, no.
no, go ahead, Amadei.
Oh, no, just really quickly, actually, NYC.gov has a dedicated page specifically for naloxone, also known as Narcan, training for people, and also they will send you a free kit. And as well as you can sign up for virtual lessons on how to administer naloxone. And there's also a dedicated page on NYC.gov. So if you just type in, like, if you're on the run or on the go, you could tell someone, Google NYC.gov, naloxone, or fentanyl test strips, and there's dedicated pages. It's already, the information we're talking about is already out there. The bill is just going to expand the reach, and hopefully more people will actually, use these resources. So we can also send you the links. I can probably drop it in the chat as well. But sorry, Jessica, go ahead.
No, thank you, Amadei. And just to build off what you said, where to find these supplies, as I said, I work at a syringe exchange in Mount Vernon, where a hop, skip, and a jump away from the Bronx. Many of our clients come from the Bronx to get syringes. We have Narcan, we have test strips. And there's also an online resource called New York Matters, Matters. They send test strips in either doses of 50 or doses of 100 to individuals, or you can get 500 as an organization. All you need is an address to ship it to, and they can send you both fentanyl and xylazine test strips We won't get into xylazine tonight, but they can send those to you directly. And that's a really great resource to have, especially if individuals don't feel comfortable getting test strips from hospitals or clinics that are offering them. In case there's stigma or they feel self-conscious, they can always order them themselves online. Additionally, Matters, which we also work with, has a syringe exchange program that operates mostly online. So you can order syringes and they get delivered to you. Now, of course, there's no cost. There's no documentation. There's nothing like that. It just takes a couple of days for those test strips and the syringes to get to you. So this is a different resource that I know of simply because I work with it.
But someone cannot just walk into a pharmacy or a library or any other place and pick up this for free, right? That's not
No, so I don't think that
They're not
libraries
being
have test
offered
strips.
in those kind of locations, and that's why this bill would help to get that into those kind of organizations. So right now, as we speak, Narcan is only administered. It can be received through, you have to attend training, and you can also get training done through DOHMH. They offer training sessions where you individuals can come in, they'll get trained on it, and then you'll be administered kits. But as it speaks, no, there are pharmacies, like local mom and pop shops, like or Dwayne Reed's or CVS pharmacies. No, they do not carry the Narcan. You cannot receive it. It's. I mean, Narcan you can. You cannot get the fentanyl test strips.
Right, test strips they don't
Yes,
have. They have
correct.
Narcan, but there's a copay, and a lot of our
And
clients can't
don't
afford that.
have the resources to pay for it as well.
And what's the ease of use for these test strips? Like how quickly can you get a result?
May I? Yes, so the result is 5 minutes, less than that sometimes. All you need is water. We recommend tap water or bottled water just because we don't want the minerals to interfere with the quality of the test. And you need some sort of a little bowl or a vessel that is clean. Try not to keep it like dirty or anything. And what you would do is you would add about a teaspoon of water, put the test strip in it, put a little bit of the substance in it, wait. At 3 minutes, you should see at least a line forming or 2 lines forming, and then you have your result. And that's it.
So a
And even
single,
though,
sorry, Jessica,
yeah.
so a
No,
single
go ahead,
line,
Nikita.
so a single line on the actual test strip indicates the presence of fentanyl, so as Jessica was stating. So 2 strips obviously would mean that there's none detected, but a single strip definitely indicates fentanyl present.
And even though it requires the use of a little bit of the substance in order to test, we found that clients are willing to part with that tiny bit in order to know if there is fentanyl, because then they can use with someone, they can call a hotline where somebody stays on the phone with them while they're using, or they know, okay, this is fentanyl, I have to be safer. And we actually have clients that are like, okay, good, let me take more test strips. We have clients that take test strips by the box, and we have clients that take test strips like 2 at a time. It depends. But at least, like in my case, they're accessible, but they're not accessible everywhere.
Do you get feedback from people who take the strip? Like, what do they do when it is positive? Do they toss the drug or they take it in a safer way? Do you get some feedback on that?
That's a good question. So a lot of our clients do not toss the substance because it's usually on the more expensive side, or they have paid money for it. So they don't want to completely part with it. However, they understand that fentanyl is a lot more dangerous than even they understand in certain cases. So like I said, they either use much less than they're accustomed to because they still know that fentanyl is quite potent and they can still get the achieved desire from that. Or like I said, they use with someone else, or they make sure they have Narcan, or someone in the house has Narcan, or they're using with someone or using with friends. And whether that's the solution, it still encompasses harm reduction, but the test strips at least give them that knowledge.
Okay. Excellent.
Sorry, I wanted to also, if I may share my screen, I found some stats on overdose leading to death within different areas of the city. This happened, this stats is from last year, of course, but just for us to get some idea here. So I believe our district here, this is our district here, right? For Community Board 8. So it's not within the darker blue areas of indicating overdose deaths, but it is concerning. It is getting there. So it's definitely a relevant matter.
And just to give some insight, I at DOHMH, we actually have not completed the 2025 um, uh, newsletter yet to give the updated numbers because we're still obviously working on it. But um, this is just it's not it's valid enough to let you know that yes, this is still a big crisis because I don't know if you've all heard in the news that they've tried to minimize the deaths of overdose and tried to portray that it has actually declined when it has not. It's just that less cases are being reported, which is the reason why it seems like the numbers are going down. But you will hear occasionally, some stories do get through the press, and you'll hear that individuals are dying from overdose. Um, and fentanyl, because of the toxicity, and people are more aware about fentanyl now than they were in the past or even just last year. But as Jessica stated, they are now you going to different forms of um, substances which still contains fentanyl, but now we can look at it on sub-levels of fentanyl, which is still detected in the blood once, unfortunately, that person overdoses. Um, and xylazine is another one that's on the rise, which is, used for animals, tranquilizing animals. So these rates are current, but it's still a very high rate, especially in underrepresented communities like the Bronx, Brooklyn, Staten Island, um, Queens, Manhattan, and a lot of the overdose deaths have transitioned from the younger population between the 20 and 30 age range. It's now gone back into the uh, more senior population. So between ages 55 to 65, you're seeing a lot more overdose deaths related to fentanyl. And it has shifted gears from African American and Hispanic to white males specifically. Um, so you'll also see that and hear about that as well.
Thank you. So we'll take the screen back here. I think, first off, I think one of the things that certainly strikes me as interesting is it's analogous to when we consider the early days of needle exchange, which was lambasted by many, but the reality is it was a form of harm reduction. And the reality is that we cannot stop people, but we can at least keep them safe and keep them alive. If you're alive, you have an opportunity to to recover.
Actually, one question,
Yeah.
does Bill 1179 talk about safe use? Or is this explicitly about test strips and knowledge of them? Does it talk about the other harm reduction pieces?
So I can take this one. It doesn't, it's actually, because it was just introduced and it didn't really go anywhere. We are, the chief of staff has actually informed us when we met with him last week that the office of Councilman Botcher is open to different ideas or amendments for the bill. So they are taking this very seriously and also like people's suggestions very seriously, which is kind of why we also chose this bill because it was very basic in its form, but it does have so much more potential to be very specific and expand, beyond just the fentanyl test strips. So we can definitely make sure, at least for us, obviously we're not just going to be the only people involved with this, but upon reintroduction, he did ask us as well for our different strategies that what we would do and how to expand this bill. So they are very open. The Office of Councilman Botcher, he's District 3 in Manhattan, is very open to talking to the communities and hearing what they have to say about, especially for harm reduction strategies.
Just if folks don't know, the safe use sites are, I think, a little more analogous to the needle exchanges in that it provides a space with equipment, with people, professionals, or you can go in with a friend, they have the test strips, they'll test your substance before you use it, they have Narcan if you do overdose. They tend to know what to say when they call 911 if they have to call 911. But there is I know the city has a few, I wanna say less than 5. It wasn't on that project, but there was intense pushback and negative press about supporting it and a lot of NAMI.
Right.
But to your point, if they're gonna use, because addiction is complicated and let's keep them alive so
Right,
that they
right.
can beat this illness and not put them back in dark alleys, and anyway, I'll get off my soapbox.
Exactly.
Yeah.
Also, the high rates of, relapsing. It's very real. Like the 2/3, like imagine 2/3. That's a big, big number. Like 2/3 of people in post-recovery addiction treatment will probably relapse. That's a very high number. And for people that just want a second chance, you may slip up. You're human, right? So we're not all perfect. And again, this bill is also the educational component and also the more mass marketing of the already like these resources are already here. That's part of like why this bill is important is it's not like they're coming up with anything new. It's just that they want more people to know more, like more people to know about it. That's why it's so important.
Yeah, if I could just interject real quickly. We have a lot of, as Makita said, an older population who have been using for quite a long time, who are scared, terrified, if you take the word, that fentanyl is now in everything. If anything, substances should be called fentanyl and something else because it's cheaper to manufacture and it's easier to put in substances. So we're seeing an older population that previously had not ever encountered this, that is now overdosing at a higher rate, perhaps fatally, perhaps not fatally, using this. And because they are seniors, because they are senior citizens, they're not aware of the new emergence of test strips or the information that test strips can give them. So, as Makita said, this education campaign is not just for community organizations, it's also for seniors, which is a large population in New York City, especially, in the Bronx area as well.
Okay. Thank you. That was all very informative. So I guess the big question at this point is you've made a wonderful, very well researched and very impassioned presentation. What things can we do as the Health and Hospitals and Social Services Committee? What things can we do to help? And if we were to be involved, how do we help get this forward for you?
So, thank you so much for that, first and foremost. But the best way, is definitely through advocacy, getting the word out to other, facilities, getting them on board, informing them about this bill, and then collectively, us coming together and taking our support to the chief of staff, right, who will then be able to push and say, hey, we have communities lined up. These are who are willing to sponsor this cause, and that will help to get this bill pushed through a lot faster, just as we decided that we weren't going to extend past our assignment because it's such a rewarding and excellent bill that we're going to continue on and try to attend as many community board meetings to get the information about this bill out there. There's more community board meetings that are coming up, thank God, before the end of the year, that we're going to be able to at least vamp up a few sponsors. And then that way, when we meet with Mr. Wilson again in January, we can then say to him, hey, we've visited and we've spoken at Community Board 6 through 20, and we have gotten the support of a lot of the community members, and the public is aware, and this is how we would like to continue on. And then we can all collectively come together and say, okay, well, now we can strategize to implement and get this pushed through, however
Yeah.
that
And
looks.
has
Yeah,
this
also
been
just,
presented to other boards?
sorry, go ahead.
Has this been presented to other boards?
Yes,
Yes.
yes,
Yes.
it has.
Also, just to piggyback off Makeda, we there's different strategies. I mean, but you can also reach out to your local council members, because they as of right now to date, there are only, I believe, correct me if I'm wrong, there are only, I think, 2 other sponsors
Correct.
for this bill. And
Correct.
again, it is being reintroduced, so hopefully it will, get more traction this time around. But speaking to your local council members, and for me specifically, I live in Woodlawn, and it's a very Catholic Irish neighborhood. And I'm actually trying to figure out different strategies to reach out to faith-based leaders and hopefully kind of educate them on this bill and what the bill entails, so that hopefully maybe they can reach a more conservative demographic that might not be willing to listen to somebody that's not a non-denominational leader in the community. So, different strategies like that would definitely help and maybe push forward and have people be more, willing to, hey, reach out to your local council members, so start small and then, figure it out. And as you go and collectively, maybe we can do something about it. So.
Also, if I may, we talked about how this was started out as an assignment and it's evolved into us sponsoring this beyond our master's pursuance. So I guess what we're saying is we're in the preliminary stages of forming our own type of coalition to support this bill. And even though we've met at other community board meetings to in the future, probably in the next year, be able to go back to this community board meeting and count you as an ally and as a resource that we can then tell Chief of Staff Carl Wilson for Eric Boschner, look, we have support. We have support from the Bronx. We have support from other areas in the city. It would give us validation. It would give us power and strength as we try to reintroduce this bill come January and possibly into the first quarter of the new year, and not just the same support that it had the last time when it ended up not going anywhere.
So I live in Brooklyn. I'm sorry. So I live in Brooklyn. So I
One moment, to point of order, we're gonna have a representative, Dr. Gomez speak for 1 moment.
And I just, no disrespect, I'm a PhD in social work, been social worker for long enough that I've seen a few things, not so long, I'm quite jaded, but we do have some other agenda items, so in the interest of time, I'd like us to focus on what we as a committee are going to do. I would like to propose that we as a committee ask FARA to monitor this bill as well. Just again, maybe my jaded side showing, I think at this point, I would be comfortable supporting its reintroduction and that it be fleshed out a little bit. I don't know, we would have to see what it becomes, we'd have to do check-ins with you guys, because there may be a line, I can't conceptualize of one. But it may be out there that we have to say, that the people we represent, we can't support that piece or something, but I would also recommend that, as part of your coalition that you guys kind of do regular check-ins. You can either come to this meeting or as you have updates, email the office or Dr. DeBeef, whoever you've been communicating with, and ask to be put back on the agenda. We can report out on this, if I may be so bold, in January.
Absolutely.
As you continue your coalition building and, Zoom world tour of making sure folks know that this is out there and that all the good it could do if we gave it a chance.
Do we have a copy of the bill as it currently stands?
I don't have one, I don't.
No, I went.
Oh, I was like,
Does the board office have one that it could share with us and our fellow members?
We could definitely send that to you from that email that was sent to us for the Zoom link. Is that a good email?
Yeah, I think, to Community Board 8, yes, absolutely.
Perfect. We can definitely send you the link. It has its own link too. So yeah, definitely send that to you.
Thank you. So I think it's fair to say that I speak for if I'm wrong, let me know. But I think I speak for the committee where we are very much in support of harm reduction and things that will benefit the community. That said, as representatives of Community Board 8, I think it behooves us to look at the body of the material and I think we can at that point would be able to either present this to the full board and also see how this fits in with our community and to what extent we'd be willing to support it. But I definitely would thank you not only for the work that you've done as students, but going above and beyond and truly being really engaged in the health and welfare of this city. So thank you so much, and again, looking forward to getting that copy of that bill and again continuing to interact and liaise in the future.
If I may, real quick, thank you so much for having us. But if it's okay, can I also email the flyer that one Organization Matters has where you can order test strips? Can I send that to you as well? That way you can share the information.
Absolutely.
Perfect. Thank you.
I'll also send you all the little the resources that's already available from nyc.gov. They have little posters as well. So I'll send that to you
send it
guys as
all
well.
over, they can put it on our website and
Right.
that's something we do really well as an information hub. We know how to do that really well.
Okay, thank you so much for your time.
Thank you. Right. So I think next will be the topic of unfinished business. So like I said, there's an open position for vice chair.
So I will say that Dr. DeBeef and I had some discussions, and I don't mind being an alternate vice chair. However, I am terming out probably first out of this group. So I really think that and I've been chair and I've done exec and I'd like to yield to have someone get that experience if you want. I also, would be happy to be a resource and an alternate. Again, you can't make it or you're not sure what to do, tap me and I guess now you can have two. But that's been my kind of sticking point is just, I am a vice chair, I've been vice chairs before. I just would like to give someone else an opportunity as I think a year-ish from now. I think I term out in 27, so June of 27, and people are starting to term out now. So that's my stance, but
I think the other topics is some of the stuff that we've discussed last. So, as a matter of fact, I think hot off the presses is I believe that Senator Rivera might have availability in January, and I think the 14th, which is our next proposed meeting date, could work for him. And so if we are interested in having Senator Rivera at the meeting, if we can start thinking about some of the topics that we would like to have him discuss, maybe even this bill, I think would be something that would be valuable. And I think if we're all in favor of that, I would certainly send that message back and have him added to the meeting agenda. I think we continue to look at, as soon as I hear back from a lot of these other resources from the last meeting, I'd be more than glad to update you on that and take it from there. Any other things that we have failed to discuss?
I know we picked about last, or it was mentioned, I just can't remember where we landed, I mean, I swear I looked at some, I get. Like if we were thinking about a summit of some kind, where yeah,
So, yeah, I think one of the things that we did discuss in part was whether some of these topics are big enough that it and cover enough topics and groups where we could have some collaboration. And I think we talked about it briefly with the department, with the group, with the committee on aging, especially with the issues regarding domestic violence and isolation and caretaker abuse.
well, I think the aging, but also maybe public safety.
And public safety,
'Cause I
absolutely.
think people still kind of be like, well, that's a personal issue and they don't understand how that can affect the community at large. I'm also just trying to think of things like fentanyl test strips could be a public safety
Right.
issue as well, right? It's using resources.
I don't think a lot of people know where to get it, like, I don't know the people who use drugs on a regular basis really know that if you can walk somewhere nearby and get it, like, I know, like, in New England, all the hotels have free Narcan, like, when you check in, there is a dispenser that you can, and because there is a lot of people are overdosing while they are alone in a hotel, or maybe there's a stat. Just so, but I don't see that in New York, but we do have, I mean.
I don't think it's very widely known there.
Again, this is my world, so it's like I hear about it all the time, but like I work with a team that goes into the community and trains people and gives them out, so I'm a little biased. I do think Narcan is better known than the
Right.
test strips,
Yes.
Right.
and believe you alluded to earlier, there's a whole other Xanadine,
Right.
which like is a whole other wave of mess that people aren't even talking about yet, and rabbit hole, but when to bring us back, the summit, were we talking about, like, did we want to pursue that, I think is the first thing, because then we don't have to keep talking about it, if the answer's no, we can move on to other topics, but if we do, are we, like, should we start talking about concrete steps to move that project forward?
I think that would be, I think, a wonderful idea, and I think one of the things that we've been discussing and concerned about is that we create these committees and they don't truly completely exist in a silo, right? Like if you're going to if it's domestic violence, you're involved, that's public safety, as you said, right? And it's also health. Things that involve the youth. I mean, there are lots of places where and the reality is I think that the board should be kind of interdigitating rather than functioning in separate silos. And I think it would be marvelous if we can do it. I mean, I think when we may just start small, start with one committee and then see how we expand it from there.
Start with joint meetings and see if it's a meaty enough.
So again, the first question is what will be our first topic? And what would we target first?
I would propose domestic violence or inter-partner violence, only because it's something that the committee has been
We've
made a priority
made it priority.
routinely.
We made it a budget priority, absolutely.
And then also, hopefully that'll shed light on, if we're gonna make it a budget priority again, is there a way that we can refine it that'll give it more attention or make it more likely to get funded? That's my 2 cents, I'm talking.
No, I think that this is a conversation. I think, like I said, I have reached out to, unfortunately, the data I got from the domestic violence officer's precinct, I was like, do you have a brochure you can give out? And he's like, these are the things. It's like, okay, like, can I stop by and get something? These are the things, okay. But I think the Safe Horizons, I will try to punch and see if we can, let me rephrase that. Do not say punch in the context of domestic violence. We'll continue to reach out to see if, poor choice of words, but if the Safe Horizons, they have a host of resources and that may be maybe a group that we can interact with and then hopefully have that and can, maybe in conjunction with public safety, we can reach out to them and have some forum together in the near future, and target maybe the next couple of months.
Yeah, I mean, again, I could make an argument for most of these committees, but I like to argue, so. I mean, like, you could talk about bringing youth in of the effect of interpersonal violence on children in the home. You can bring up aging, cause you, but.
Mhm.
But that might be a lot to try to.
Getting one committee together is in itself a task.
It's hurting cats.
Yeah, in my mind, it's the more committees, the more dates there are available,
Yeah.
right? Then,
Sure.
but that's my own hang up.
All right, so I think it sounds like we're in consensus that we will target domestic / intimate partner / caretaker violence. And maybe start potentially with public safety and reach out to public safety and maybe the aging. And then we can start with that.
We have Safe Horizons maybe present there, and then they can bring all their stuff that.
Yeah.
We can bring it back here, or. Committees can take it, or what have you.
Okay. Again, discussion of budget, fiscal year 28 priorities, something that we should all start keeping in mind. Thank you.
If we can start, probably start reviewing what was in 27 and then take it from there.
Absolutely.
I also thought Senator Rivera might give me good insight on.
Yeah.
Yeah.
What maybe needs our attention, that if we have a blind
Right.
spot.
Right, so I think so we can target maybe having a copy of last year's budget priorities for the next meeting, and then hopefully in conjunction with that communication with Senator Rivera, we can.
We had to keep in, mind how the health insurance
Right,
is gonna,
absolutely.
whether affordable care subsidies are gonna last, or how many people are gonna lose insurance or get insurance, which is not good enough for them. And I do not know. I think the state budget will address some of this, depending on what happens in Washington.
Right.
Might have a lot of community members without coverage.
I mean, we might also have reduced service in hospitals, like I know we don't have one, but if Allen Pavilion and Montefiore lose staff because they've lost federal money, like.
Right.
They have lost that.
Yeah, see, I didn't actually wanna know, but I mean, I wanted to know.
We're waiting for the other shoe to drop.
Well, I mean,
Medicare.
we're not a small rural hospital in insert state here, but it doesn't mean that we're not gonna have an overworked population already being asked to do.
More.
A lot more work, which burnout and mistakes, and then we're gonna blame them instead of the lack.
Yeah.
Yeah.
There are unknowns, so we don't even know. But maybe while we are in the budget process, things might come up, it might change priorities based on how things. Another thing is, like, it's on the news a lot, and you might be the flu cases in New York City.
Yeah.
It's a huge spike. What we hear, I don't know if there are any deaths. Or obviously a lot of people die every year due to flu, but I don't know if there is a huge spike.
No, it's the city department and the state department issued a notice yesterday or the day before. About increase in number of cases of flu. And the drop off in number of people vaccinated at this point. And the fact that this seems to be a pretty virulent strain this year. I mean, I don't know whether there are organizations that we could work on to do a come get your flu shot campaign. Whether
Is it worth reaching out to like Health and Hospitals?
well, within our district,
Well, I mean, if they could tell us
Tell
for
us,
somebody
yeah,
here, like,
right,
I don't
yeah.
know, but maybe Lincoln would, right, or.
Yeah.
and Montpelier is on the edge of the
Right.
district, but there are at least two Montpelier Medical Group
Right.
sites within the district.
And senior centers and
Right.
youth centers that they might be able
That's
to
right.
get, we could maybe get that going.
They do not do the mobile ones like they did for COVID. They don't do flu shots mobile, right?
Well, the COVID mobile tests, and I don't know whether they were, were there mobile shot sites or just test sites?
I wanna think like
Short
pop-ups.
tests.
Pop-ups.
Like Yankee Stadium
Right.
hosted one,
One,
and there,
okay.
I got mine at like the church somewhere and.
But we were also dealing with the time where I think it was heavily subsidized.
And I think they were under contract or with arrangement through the Department of Health.
Sounds about right.
So,
But I think it's worth looking into to see if if there is something like that available where we can, is particularly in light of this spike. So that's definitely worth looking into.
and what would be the process? Someone reach out to one of the facilities or talk to the Department of,
That's part of, that's half the battle is who do we even ask? I mean, I can ask around at work if anybody knows who I could even point me in the right direction.
I could make an inquiry, to somebody at Montefiore to see whether they would be interested in.
'Cause I feel like
I'm not
sometimes-
sure how, I mean, we'd have to figure out how it would work. Someone would have to have the supply of the vaccine and needles and the people qualified to
And the sharp-
administer it.
and the-
And then,
Is it free? If you don't have insurance, you can get a flu shot from pharmacy. No,
I'm not sure.
I'm not sure either.
I haven't
thought
gone to a
about
pharmacy I don't already go to,
Oh,
so
right.
they have my insurance, so I don't know if they
Insurance, yeah.
actually run
Yeah.
it or not. And with the current administration, not believing in vaccines, I mean.
I can try to make an inquiry. With somebody. Who might know.
That would be helpful.
But maybe that's a budget priority for next year, like have,
free flu shots. right?
or yeah, like have these mobile flu shots for,
Mhm.
you know. Cause flu season starts in like September, right?
Yeah.
Well, generally it's from late September through March or
Right.
April. I think what I've read, it started a little bit late. But they expect it to run a little bit late. I know when I was a full-time employee at Montefiore, they used to start giving the shots, which were required at that time.
Yes.
I think that bill has been taken off. I don't know what's going on now, but you had to have a shot.
Now the
I think
rule is vaccine, now it's shot.
Yeah.
Or
But they started with the ED and the inpatient staff, and then they worked down. So I was an administrative position at the care management organization, and I didn't get mine until like the beginning of November. But the recommendation in the past at least has been to delay it, not to get it immediately. Because the efficacy is about 6 months, so the recommendation is to have you covered through the season. I'll see, I'll try and
Thank
make
you.
some inquiries, about, starting with. Is the immunization covered regardless of insurance?
Right.
All insurance covers it, Medicaid, Medicare, and all private insurance, but I don't know whether if you are uninsured, whether it's covered or not. It may be you have to go to a public health clinic in order to do it, as opposed to a pharmacy. I'll see what I can find out.
Great.
And we can conceivably put something on the website, right? On the
Absolutely.
CBA website.
And social medias are.
Right, yeah, so there's I think they have
There's
Instagram and
definitely
Facebook, yeah.
Wanna say we're trying to get Instagram, but I don't
I
know.
think they did, because there was somebody, somebody created one and then they fixed it, so. All right, next topic will be, so the next meeting will be January 14th of 2026, so if the world doesn't end, I will see you.
Wouldn't be so.
And I think with that, anything else that we have failed to discuss or pressing matters that need to be mentioned? Okay. Do we have a motion to adjourn this meeting, or would we like to continue talking?
So.
All right, meeting adjourned 8:08 p.m. Thank you everyone for attending and looking forward to seeing you at the next board meeting and at the next committee meeting.
Thank you so much again. Have a wonderful night, everyone.
Thank you.
Thank you, and we look forward to continuing to hear from you and liaising with you in the future.
Thank you so much.
Thank you. Good night.
Night.
Good night.